no so dale North Carolina the bamko le kakane bo dale awane Craven County awane health department tafu tama no tasahi the kind of petila that the cathedral la wane cathedral when Louis Moran no the when madama pe Pagdema Craven County Health Department de Bunili the when Mexico the Hippocapo Cathedral the Quatreva Seco da qua Gnyo po maybe the lepa copy of Podoka the pole heo pay the Panama the one Watinya da Pagno po maybe the Padoka the Podepa we when Villa the one Tinia the Pagate the Coda the Bacale Pamicole I read up the Pagabat Sevada Cati Pagret Sevada when the Catica was still Calena the what that tea for work the thing and thank you very much Dr. Moran and we really appreciate your
I'm happy to be here. I do have a mask, but I've already had 2 vaccines.
You already have 2 vaccines, okay, so you don't need to wear a mask.
I don't need to wear it for the supermarket.
Oh, the supermarket.
But you have the virus.
Yeah, I have the virus, so pretty much have the immune.
So it's nice we can sit next to each other,
right,
and talk, and not worry about the mask.
Sure, yeah. So yes, again, we really appreciate your support and help, and also for everybody else here to talk about the importance of getting vaccine. So I will let you maybe introduce yourself a little bit again so that our audience know.
Yes, Dr. Louis Moran. I'm a family physician, family doctor, and I worked at the health department here for about 10 years. And had the privilege of taking care of a lot of nice immigrants and refugees, and I got to learn a few words in Karen.
Good Karen.
Not too many.
Not too many.
But had a nice time working here, and I'm really here to recommend the vaccine or the vaccines that are available to help prevent this COVID virus. As I mentioned, I had the vaccines myself, and in fact, my wife is a nurse. She's had the vaccines, and she's at a clinic today giving shots to people. She's going to give about 300 vaccines today.
Okay. Now, when the cathedral did that demo, when Dr. Morris, where do the Koda pay when the Craven County when the health department pay the gay book of the Child that Sebagati Willie. There was sick of the Koda, the Pavilion Pool, the correct community pay when the new Craven County. The Honey Burger, Dedico, Bangole, Cathy Kind, a redole of about Selema, where he bowed at the community. When they come like Pote Park at the Yatra, the Dilla Servona. The diva then in Latinia, the Matacodale, I want a Carolina Correct Community Center, I want a Craven County Health Department. A honey can never let the Kodak a fee dollar, I want a vaccine on a COVID-19 vaccine over Calamona, what deal with that over color, we brought at the Caracane, Dallas Hall of that old dilemma. Can you talk about a little bit about how many vaccine corona vaccine makers?
Yes.
And what are their difference in terms of their effectiveness?
Currently, there's 3 vaccines available. Actually, the Pfizer vaccine is the first one, and the Moderna vaccine, and now Johnson & Johnson as a vaccine. That's just starting to be distributed. The first 2, the Pfizer and the Moderna, those are very similar vaccines. They're each vaccines that instruct the body to make antibodies, to make defense against the virus. There are no live viruses in the vaccine. That's important to understand. Some vaccines actually will have a weakened virus in it, but there is no virus in the vaccines. So you can't catch you can't catch the virus or the COVID from the vaccines. The Johnson & Johnson vaccine, the third vaccine, it's a little bit different, but it encourages your body to make antibodies or defense against the virus, what are called the spike proteins on the virus. So the virus has little fingers on it that attach to your body, and the vaccines work by blocking the fingers or spikes that allow the virus to attach to your body.
Okay.
And so they all work that way. And the differences between them becomes technical, but the important thing to know is that, they've been generally very safe and they are not live viral vaccines. So you cannot catch COVID from the vaccine. It is only going to help prevent you from being infected.
So basically, pretty much they work, effectively,
Yeah, they're highly effective. I mean, if you read the literature, it'll say for Pfizer, 95% effective, and those are projections. We know from other vaccines and our experience with other illnesses that the vaccinations can eradicate the diseases. So the best example of a successful vaccine in the world is the smallpox vaccine. And the smallpox vaccine has eradicated smallpox, which is a terrible disease. And so nobody even needs the smallpox vaccine anymore because the smallpox virus was eradicated by the vaccine. Our hope is that if enough people get this vaccine, that the virus will disappear and not become a big problem. And that's, you may hear the term what's called herd immunity. That means if enough people have either had the virus or get the shot and they can no longer catch the virus, then it won't get spread and it just disappears.
Okay, thank you. Now, come here, the fee on the level to talk about the coronavirus, the fee, the order, company of the Pumana, order Montana, Kawane fixer, the biotech, the card, the card, our Johnson, the our third kind of Madama, how do you need this of Solomona? Come here, made that is the Mitchell, brother, when they got the old honey done, the knock, our name, for them at that daughter. Community when it does honey away banner our net the nil banner. Community taba you learn the chair who the coronavirus banner, community check the car who did the Obama. Community the kind of Oda well the chair and did the work eat on your done our body immune system. Community the learn mopua not con that daughter the local obu did the local draw our da when that's ha the buy, no? Come on, target candidate, learn the match, me no, I don't know here where do the popular, but them a let touch her, call one smallpox, that's how one taught her that of who the play, that's how one linya oh, the old canning with them a lucky the what Chebaka could see, atho, what Chebaka or blood, that's hard bunny lucky the law market, no, law market, a bumble a couple away. Và then don't about that on it that dog the holder was the Kahaku or tag on it all about the Kikita feel or Mavi. The dinner of head on the corona when the virus that's hard kind of getting Wakoa de me cheba blonde common in the Koa de Milda no quota dog the dear blonde away let us ha when back udan the all by the common oil by not all by holder. But them a couple of Wakoa de order that of the holder over there Abijani lucky Kalomagi, I want to give you the Kalomagi when a theme on the lucky county because they're called Baka, I don't know, may check the field kind of where them a jala side effects, Mona, did a lot of portrait that keen to what I go to me, I go all delay, they're panning up, kind of because they're the call, we brought the the field kind of the budget to a planet is like where Dr. Dana wanted. So, could you also tell us, a little bit about reactions, some of the serious reactions, and also is there rescue, treatment,
Yes.
when someone, react to these vaccines, and also how many shots, people basically are needed to be protected.
Yes, well, first, with the Pfizer and Moderna vaccine, those require 2 injections. That's what's recommended by the manufacturer. So you get 1 shot to begin with, and a second shot about 3 weeks later. And the idea of the second shot is it lets your immunity, lets your resistance to the virus last longer. So 1 shot does protect you, and there are studies right now to see if 1 shot is enough, but the 2 original vaccines require 2 shots. The J&J, the Johnson & Johnson shot, is only requiring 1 vaccine, so that's an advantage for that vaccine. The J&J shot doesn't have as good numbers as the other 2. It's still good. The Pfizer and the other, the second vaccine, they protect like 95%. The J&J, I think they're quoting like 85% or something. It's still very good, but it's more convenient. So it's basically 2 shots, except the J&J is 1 shot.
J&J 1 shots. Okay. Are there like serious like reactions to?
I had 2 of the Pfizer shots myself. After the first shot, my arm was a tiny bit sore. It was no big deal. After my second shot, the day after, I felt a little achy, a little stiff, but I'm 70 years old, so I can wake up any day and feel a little stiff or a little achy. And I took 1 Advil, and that was it. I mentioned that my wife is a nurse, and she has given probably 2,000 shots to patients, and they haven't had any serious reactions. My wife had 2 shots. The day after she had her second shot, she felt achy and had chills, and also just taking an Advil took care of it, and then she was fine. So I would say serious reactions like an allergic reaction are very rare, and my wife's experience of giving over 1,000 vaccines, they haven't seen any. The places where you get the vaccines are prepared, if you did have a reaction, to give you medicine to counteract a rare allergic reaction.
Thank you. Now, when the tablet on a common order, aware tape, other back, like a feed kai honey, when oh, Cathedral or the Mimele, aware chemo, or the Nagabase, our key, our the Muna and Nagabase, keep lemon, Mimele, our name, Moderna and Nagabase, our name, keep plet, the plet. May we got the leg, our the plan on the kinui, we are lucky in a mother and Nagaba, our third we were lucky than Nagabase, that plet, come on and keep plet. Maybe a mother when in the knock or tata the dene low poemona. The Mimele Cathedra, Mimele did when it fits about tech, the one Jin and Gina, the Joseph audio when in the Gabase, when the plurana, come here when it the plur. The Cathiki Kadu did not then at lost horde, Kikathakan at lost horde, but then I get Mimele did Moderna honey mother aware that of the day we said, or that quisi yem like a young penimona. The Mimila Sardale, when Jin and J. How do you tell that or Hossi Yemagia? The night I Hossi Yemagia, when a pagwe di Yamana. The Leawata, Le Coplo, or Pocone, away Cheba, were maybe the Le Amasik or Cathedra, the Cheneva in your Megane. Come up, all like a told Pagatomona, Samuel and the tea where the when the dark gate hot, not me back. No, come and get that is that without a car, let the butter not me back. The Mimila Gaja. Oda le chewe we lucky the tuba oda di da le you do chat jet more mona jane did the book de ma miller ma how the chair will keep blood planning lots of that check keep blood where the mother then tag a blue at the top the jet and all of the feet did the book de ma jale ibuprofen the panel the loma loma the le did the tag get how do mumu a god pass it on it oh grobana meet the meal na order allergy that let the pot and naba I want to meet the oh banet now come on make it hot that lene when the fee ka thaw opa je we mo na ko na do ne le che kha ne da ka fee I want le ta sa hi ne wa ma kha da ka fee le I want lu dot the data ko da ma I want lu I want make it hot to me da lu ma pu plek na mo na de ko da le I want rescue I want treatment ba ne o ko ne ta ko ta go o ba na ko na ne che le ta make it hot to me ne ka fee ne I want la ga o da wa che pya ne ke na jan mo na the Honimeda or our level Bathina, the Thina Guamona. There got cardiac cane, because Ed of Death Corda Lossos, Dabaka, the Fee Canines, Heme, we needed our CDC, a Dapa Plathone, our a Gadlathone, took them out the Letal and the Mathi, no, the Mathim that dim that did the Lenime Chebak, the feeble on it, Honepoca, Death Cord, sick of Hemona. And
Can I just add one
oh,
thing?
okay, sure, go ahead.
When you get the shot, it only takes 1 minute. After you get the shot, you are asked to stay in the clinic for 15 minutes. And that's the nurses make sure that you're not having an allergic reaction.
Okay.
So after the shot, they ask you to stay for 15 minutes and they observe you and make sure you're fine, and then you go home.
Okay, good. Now there are quite a color of Debia and a fear in the chain Yolamona, the chair that the Manila go on, the chair we brought there when the Cathedral Moon, then panic more than Ocots, not to see Yemeni. Now, Bamnicola, Talon, allergy, Bunny, make it on the middle pot and now and they paid to see Yemeni, a double near where Plat Holomona, for the Cathedral Moon, the Banner near the more than Ocona to see Yemeni, may we brought there when they made a banner near the Nekehi, the Lomona. And can you also talk about, CDC, guideline about, after you receive the shot, and then there are things that you can do that other people, who have not received the shots, cannot do?
Yes, well, that just changed recently, but the CDC and most scientists, so doctors, we listen to the CDC, but we also listen to our own experience.
Right.
We know that once you've had the vaccines, that you can't catch it. And so you don't have the same restrictions. The CDC recently said that if you have a group of people who have had the vaccines, you can get together in groups. You don't need to wear the face masks. And your chances of getting the virus or transmitting it are much, much lower. So after you get the vaccine, if I go to the supermarket today, I'll put this on to be polite, and I'll also put it on in the very rare case that I could transmit the virus, but it's not likely. It's almost impossible. Okay. So, basically life goes back to normal after you get the vaccine. After I had my second shot, I actually felt relieved because I said, well, this is great. I can go out now and see my friends and, not have to worry about, who was where and if I was going to get sick.
Okay. Now, come on, Kaka Honey did the Pema Pamela CDC, double Bathianina, I want America, I want Center for Disease Control, double Bathiani, come all while I check out with Banner, Dala Gablin, that Elena, Benefin, or Dale, the Mehale, indoor, Baclami, come on in the low. But the Majale, I want Mal distil of Amona, the Babu Chachiloba, we got the Kimid Mia, the low tall, I want a Maslaba. The me add a tall in the top demona, let up back, I want a boy, the blood corner, Hale, Baclav, but in the chair with Papa had I want a Bagdema, the Nako immune, I want a protection, the Vidi Bacanina. the dita I want Morris de wa so ni la na ko nya wa de che wi de ne ta ko da ko all ba ma na ko nya ne ko te ma ha le de mu ko kla le ha o de ko I want de mu ko se ko le ka ba ki ka sa me ke ka he lo ke pa nyo me ke ni I want it all ba ma na de le ki ka ne ba ka te de ko ba kha le di ta ba me ba ta no ne ba ko da le e do ti nya ra me che me wi ne me I want do ne ba ta har kha ne me ke te dia men me ba ho da che me wi ne pwa ga ta sa me o ne he ba ku na ke te dia mo ta kha ne ba ka te de ko de se na pe and we also like to turn to the other issue where some people are asking can we still receive or be infected by other people if we already received the shot or the vaccine and the other people still have the virus and not the vaccine can they still affected so.
Yes, so if you have the shots, if you have the vaccine and you're near somebody who has the virus can get in your throat, say. The virus comes through people coughing or sneezing. The virus can still maybe get in your throat, get in your nose, get in your eyes, but it's not going to go anyplace because your body is going to neutralize it. It's going to kill it. And that virus will only be there for a matter of minutes or a half an hour. Some people say if you even gargle with mouthwash that gets rid of it.
Okay.
So basically you don't have to worry about catching it, and you're much less likely to give it to anybody.
Okay.
So you're not going to be carrying it. You might carry it for a half an hour, but your body is just going to get rid of it.
Okay. Now come here ne bam ni ko le kwa to no de da tin ya la na do ne pe che me wi ba ne me di da ba ku da ke te dia ma kwa kha ko ne he ba ku ba ke te dia to ni ha lo ba kla da kwa la ta kha o ba ne come here ne e do te ha ne o ne che me wi ba de kwa le ka ba he ba ku na go de te nyol ba mo na bam ni ko le do ne me le ba le kwa kla da kwa ta ga ne ta kha me o de I want to tie the canoe on that kind of canoe and the Nadi Pua, me and the Copua. Then I go that canoe, the Jopo blood, the Lucky, the Loma, not the Connery, Bamgo, I work and learn a Coopu, like my bad donor, could do choking and it, the Nilma, couple learn knock hole, I want to attack the Dene, Opa German, that dot the Delen Cobun, only a honey, but them aware, Takan, Millennia and the Cobun and Nadi with the Nago Dave and it's so a lot of connery there where need a lot Magilomana. A cone may tell a poor the Bala Chebawada, I want to see the buy how do you I want to Kabaku or maybe I want to get the Nitas had a Kabaku gave maybe sick on it all Obama. The